It has been a rough week, but I want you to know that you are not alone. You have people fighting for you in Congress every single day. People like Representative Sarah Jacobs, who was arrested on the Capitol steps for fighting for reproductive freedoms, and who introduced legislation last session to protect your medical data. Representative Jacobs is only just getting started, and so should you. Roll the tape.
Hi, I'm Congresswoman Sarah Jacobs. I represent California's 51st District, which is in San Diego, and I'm actually the youngest member of House leadership and the youngest woman ever elected from California. So Project 2025 basically would take away access to abortion across the country, even in states like mine in California. And one of the things that I think is the most scary is that they actually want to create a federal national pregnancy and abortion database, like a full surveillance system of pregnancies and abortions, which means it would supersede HIPAA, it would supersede any other privacy. Like, they would literally be getting information about miscarriages, abortions, everything. We've already seen that kind of data be used to prosecute people who are seeking abortions and those trying to help them. And think about how much worse that will be when there is a national centralized treasure trove of this data.
People think because of HIPAA that is not actually possible, so they read about these plans to track pregnant women and such, but they think that HIPAA makes that illegal, but it's not.
It's not. So HIPAA actually was not written for this post-Roe era. So there are provisions in HIPAA that say, for instance, if something is illegal under state and local law, then you are permitted or sometimes required to give information over to law enforcement. Same thing, HIPAA has carve-outs for giving information to the federal government for all kinds of reasons, right? You want to be able to do public health surveillance, these kinds of things. I actually have a bill called the Safer Health Act that would close these loopholes in HIPAA and make sure that we are protecting people's reproductive health data, even if it's illegal under state and local law. The other is the My Body, My Data Act that would make it illegal to sell or share any reproductive or sexual health data from period tracking apps, website searches, anything.
A lot of people use period tracking apps
Yes,
because
they do.
we need to
Right.
help us understand our own bodies.
Exactly. And right now there's really no federal protection for that data. I first introduced my bill around period tracking data. I first had to explain to people that yes, we track our periods, and there are apps that help you.
Yeah.
And as a result,
There's an app for that.
Yeah, there's an app for
a
that.
lot of things, and there's an app
Exactly.
for period tracking.
Yes. And as a result, I became the first person in House history to talk about my own period on the House floor.
Yes, love this.
These things really matter because if they don't know about it, if we're not talking about it, we're not making good policy about it. So talk to the people in your lives. Talk about why reproductive health matters. Talk about why reproductive health data privacy matters.
Yeah.
Like, the more we can get more people to understand, the broader the coalition can
Yeah,
be.
so we need to increase the pressure for people calling their own Congress people to support bills like this, right? So it's like the conversations that happen, we used to say at your dinner table.
Yes, if your
in
group text message.
message, tell them about how you use period tracking apps.